NHIA aims to finance access to care for all Nigerians. And we know that one of the critical barriers is financial. That's where insurance and other strategic purchasing mechanisms come in. But access to what? To what kind of care? I'm sure when those that founded NHIA thought about it, it was access to good quality care. And as a result, it's not just important that people show up at the hospitals, but it's also important that when they show up, the care that is provided is of good quality. And I'm sure if we flipped it, you as the provider, you want to ensure that your facility is known for providing the best quality care available. So that's where there's a meeting of minds. And what we want to do is make sure that people can have access to that good quality care that you're providing, and make sure that there is a differentiation between those of you who work hard to provide good quality care versus a lot of people outside there who provide suboptimal care. And that's why we have chosen to partner with your organizations in this extremely important initiative, which is financing comprehensive emergency obstetric care. We've seen a lot of information about how Nigeria is one of the worst places in the world to have a child. We've seen all the information out there about how high our maternal mortality ratios are. But the question is, what should we do about this? So this initiative is nothing new. It's just that government wants to double down on our efforts to crush maternal mortality. It's not enough to just keep talking about it. We need to do something about it. And when the Coordinating Minister for Health and Social Welfare had the Healthcare Strategic Investment Blueprints and listed this as one of their priorities, the NHIA saw it as an opportunity to deepen our financial access initiatives. And so it was important that while we expand coverage, we also do so in a manner that recognizes equity as a cornerstone. What does that mean? It means that we can choose that the way we want to achieve UHC in Nigeria is first sort out the wealthy, then next, those who are almost wealthy, and then the middle class, and then you keep going until it finally gets to the poor. But we have chosen a policy direction that is different, one that has equity at its center. And what does that mean? It means that whereas we're expanding coverage, we want to be mindful of who is covered, to make sure that the poorest amongst us are also covered. That when a woman is in labor and shows up at her most vulnerable moments, that's not the time to start asking her to start transferring money in her account if she doesn't have it. Neither is that the time to also saddle you with the responsibility of having to figure out how that woman is going to pay for her care. Many of us as physicians, at some points, I'm sure you have paid enough money for patients that could not afford it. I'm sure your hospitals have subsidized women who needed emergency obstetric care. That burden shouldn't be on you. Yes, we should be empathetic, but neither should that burden be on that woman or that family at that particular point in time. So all we're trying to do is reduce that delay and say, when that woman shows up and is in need of an intervention, treat her and bill us. We can work out whether she's eligible, she's not eligible after the fact, but at least first you've kept her alive. And then we can do the argument. And if it works out that the woman cannot afford it, that's fine, send your claim. The claim will be honored.